So we now have a patient with an anterior beam on, and we can see in this view that's where the beam is. We can see in that view there, and we can see in that view there, and we can see that it's defaulted to a 10 by 10 field. So the first thing I want to do before we actually start manipulating the beam, I'm going to add a DRR, which will make life easy for us and enable us to use it for verification later on. So if we right click on the anterior beam down there and do new DRR, we can see it gives us a number of options in terms of changing the algorithm. So the DRR shows things like airways, chest, soft tissue. We want to show bones, so we click there, click apply, and we can see there that we now have a DRR that shows us the bony pelvis nice and clearly. If this view doesn't come up automatically, if you right click and click on beam's eye view, because this is what this is, a beam's eye view, we can now see that. We can see that we've set this 10 by 10 field, and actually it's much bigger than the PTV, isn't it? So the PTV is this red structure, and we want to conform that much tighter. So to do that, we're going to use MLCs. So again, we're going to go back down to our field, right click on the anterior field, I'm going to do new MLCs, and it adds MLCs to the template, to the plan. You can see at the moment the MLCs are all closed, which isn't much use to us. So we could, by clicking on this one here, select an MLC, we could move them all manually. But actually, we can get it to set automatically. As ever in Eclipse, there's more than one way to do this. So you could go right click down here and fit to structure, or we can use this icon up here, which does exactly the same thing. So if I click on there, fit to structure, we can see that I want to form the MLCs around the PTV with a circular margin of 0.5 to make the MLCs slightly bigger because of the things we talked around in class to do with penumbra. And then we're going to optimize the collimator jaw, but we're not going to optimize the rotation. Okay, so leave that one unticked, just tick that one, and then we're going to click fit. And we can see there, if we close that window now, the MLCs have formed nicely around the PTV with that ½ centimeter margin all the way. And if we were to turn off the structures, we can see that that's the field that we would be treating. Okay. In terms of them moving the MLCs, if we wanted to move them, we can pick them up manually by selecting this one here, and then we can pick a leaf up and move it if we wanted to do that. So we will be doing that later on. And you can see that the jaws have moved in to back up the closest MLC to reduce the amount of interleaf leakage reaching the patient as much as possible. So that's our first beam on, that's optimized to the PTV, and we're now ready to create some more beams.